New videos every day.
Okay, so I'm John Breeding. I'm back in the saddle here at Psychetruth on June 12th. One of my videos is on the role of psychologists in the torture dynamic. One of my favorite quotes is, I think, pretty sure it's Thoreau, I may be wrong, but it's that statement that my anger at my country spoils my walk. And I felt that way a lot around U.S. involvement in torture, which is just disgraceful, I think, and then also in relationship to my colleagues' involvement in supporting U.S. action around torture. So I did a video on that, but I've been writing an article called Challenging Electroshock, Electro-Torture in the 21st Century. And I'm really looking at this thing of electroshock as torture, and I wanted to share a few thoughts about that. Rich Winkle, who's an electroshock survivor and a computer programmer, said that the magnitude of the electroshock atrocity is too great to communicate. That's why it's the perfect crime. We do these rallies, challenging Shoal Creek Hospital around, here in Austin, around Seton Shoal Creek Hospital, around their use of electroshock, and some of the signs we carry. Electroshock, electro-torture, electroshock is a crime against humanity. These really strong statements. And some people think that's a little bit of a stretch to say that this medical procedure, that sometimes people consent to, it's torture. And I want to address that. According to the United Nations Convention Against Torture, torture is any act by which severe pain or suffering, whether physical or mental, is intentionally inflicted on a person for such purposes as obtaining from him a third-person information or confession, punishing for an act committed or suspected of committing, intimidating or coercing, or any reason based on discrimination of any kind. Well, German history professor Henry Friedlander puts electroshock right in the scope of this definition. Check it out. For the first few decades of its use, electroshock was used without anesthesia, muscle relaxants. Thus, it was extremely painful, damaging to the entire body, including breaking of bones and teeth. In this context, history is replete with the use of electroshock as torture. One terribly ironic example comes from the German Nazi euthanasia hospitals, right? Electroshock is torture. Clearly, there's a strong history of that. Use it on French prisoners in Algiers. This is all documented in Leonard Frank's electroshock quotationary on our endofshock.com website. They use the treatment a lot to accused prisoners, Algerians, right? To relax resistance, to come through the person's defenses, and just to punish them and torture them. United States CIA trained Moroccan security forces, same thing in the 1960s, supposedly to help with interrogations. Dr. Ewan Cameron's CIA-funded MKUltra, which there's plenty of information about now, de-patterning experiments, mind control experiments, intensive electroshock, supposedly to create a blank slate so you could rewrite the person's personality. The history of psychiatry is replete with electroshock, clearly as torture. It was pretty ubiquitous. Here's a 1953 quote from prominent shock doctors. During the past 11 years in our work with electroshock therapy at Bellevue Hospital in New York and elsewhere, we have on numerous occasions observed that acutely disturbed patients become quite uncooperative after a few shock treatments. One in the morning, one in the afternoon, until cooperative and able to be controlled. Clearly within the definition of torture, right? So that's easy to see. Forced electroshock, coerced electroshock, electroshock painful, electroshock to control and manage people or to help interrogate people. It still goes on, of course. New York in 2001. Paul Henry Thomas, a well-read 50-year-old Haitian immigrant, agreed to get zapped at Pilgrim State Hospital In June 1999, after 3 sessions, he said stop. The hospital psychiatrist court-ordered 57 more, right? Later on, they wanted 40 more. Many groups, including CCHR, including Mind Freedom, including others, came to Thomas's aid. I testified in New York. We managed to liberate him. But according to one of our coalition legal advisors, Attorney Dennis Feld, in 2007, in another case of Simone D., where she had had 300-some shocks, they wanted to order more. The situation in New York State with respect to forced shock is worse now than it was back in 2001 when Paul Henry Thomas and Adam Schisko cases arose. The State Office of Mental Health is currently asking for high-end maintenance shock, more than 200 to 300 electroshock treatments, all court-ordered, forced. It's practiced all over New York State. Texas, that kind of thing's outlawed. But around the country, it's going on. Well, that's not too hard to even see how it's torture if you have open eyes and willingness to see. But what about a supposed consented electroshock where the patient agrees to it, right? Is that torture? Well, let's talk about that for a minute. One thing we know is that electroshock is clearly brain damaging. Grand mal epileptic seizure, massive excitation of cortical neurons, cell death. People in medicine try to prevent seizures. Hemorrhages causes death of cells in the brain. Erupts the blood-brain barrier, toxins go in there, cell death. Glutamate excitotoxicity, cell death. Brain damage is apparent. Memory loss, well documented. ECT works to the extent that it damages the brain. It goes on and on and on. Memory loss is a sine qua non of brain damage, and it's well documented. And yet psychiatrists deny the brain damage. Even though now they're starting to be forced to acknowledge it, but still in the official APA reports on electroshock, denial of brain damage, minimization of chances of memory loss, celebration of electroshock as newer and safer today. It's all false data. This is on our website. But you could say, well, even if it is brain damaging, which it is, even if it doesn't really work, which it doesn't, constant 100% relapse almost, the rare exception. More and more drugs, right? Even if you acknowledge that, is it still torture if someone consents to it? Well, sure it is if informed consent is not really there. And you're lying to the people, right? But let's also consider this, okay? Darius Rahali wrote a book this year on called Democracy and Torture. He said most people think that democracies are unlikely to torture, whereas in authoritarian states, torture as much as they want because people don't control any power, right? He says, in fact, it's a little different than that. Authoritarian states indeed use scarring techniques. They don't care if they leave bloody marks or if there's brain damage or whatever. In fact, it's better because they intimidate and scare people. In democracies where there's minimal civil society, the police and the state and psychiatry want to use cleaner techniques. This means leave few marks. Sleep deprivation, stress positions, waterboarding. And guess what? Rahali says that electrotorture is the most famous of these democratic methods. Started in 1908 in New York prisons. It was called the hummingbird. Kind of shocked people, but psychiatric electroshock came a little bit later. But the argument is that the newer, safer electroshock is better because it doesn't break bones, doesn't break teeth, doesn't leave marks, right? The marks are internal in terms of brain damage. The signs are neurological in terms of memory loss, seizure disorders, etc. Here's my argument. Psychiatry is to democracy, psychiatry is to authoritarian states. One more time with this analogy. Authoritarian states are to 1950s psychiatry as democracies are to modern day ECT. Newer, safer ECT is like torture that doesn't leave marks. Listen to this. Here's the criteria from the Geneva Convention, remember? Intentional infliction of pain and suffering. A brief review of electroshock survivors' statements makes very clear that there's pain and suffering involved, even with anesthesia and long-term disability. For purposes of obtaining a confession, to understand how this piece applies, consider there are an estimated 1.5 million so-called involuntary commitments per year, mostly involving forced drugging, some electroshock. These may be clearly seen as torture. But even voluntary treatment in this light, when one considers the threat of coercion and the fact that a major dynamic of psychiatric treatment involves pressure on the identified patient to accept their mental illness, aka confession. You've got the threat of these things to enforce acceptance of an imposed belief system, aka a confession. Punishing a person for an act committed or suspected of committed. This means whatever behavior is judged as mental illness, as well as any treatment-resistant behavior. Boom. Any reason based on discrimination of any kind, okay, this nails it. This is called psychiatric oppression. The systematic, institutionalized mistreatment of those identified as mentally ill, strictly because of that identification. You get electroshocked if you're identified as mentally ill when the drugs quit working. The electroshock can be seen really as a use of torture to destroy the ability to fight back. Naomi Klein has a great new book called The Shock Doctrine, which lays out how to impose economic policies that people won't normally accept, by either creating a shock like in Iraq or taking advantage of one like Katrina, then pushing through radical economic policies, and then instituting some sort of ongoing drama, often involving torture, to keep the people on their heels. That's what happens when you use electroshock on someone where the drugs have quit working and they just keep getting worse. You destroy their ability to fight back, their ability to remember and be together enough to do a malpractice suit. That's an important piece. Lastly, at the instigation of or with the consent or acquiescence of a person in official capacity, meaning the shock doctors. You have complete, utter silence from the profession about this. I like to quote Dostoevsky. He's talking about SS officers and how they get trained to be able to be more and more cruel and more killing and that kind of thing. He calls it Blutkit, blood cement. All that business of titles and sentimentalism is a very good cement, but there is something better. Persuade 4 members of the circle to do in a 5th on the pretense that he's a traitor, and you'll tie them all together with the blood they've shed as though it were a knot. They'll be your slaves and they won't dare to rebel or call you into account. You take a psychiatrist, put him through residency, make him do electroshocks, blood cement. Plenty of data on that in my books, The Necessity of Madness and Unproductivity for one, and on the End of Shock website. Bottom line, quoting Diana Loper, shock survivor, activist, with some of her videotapes and my interviews are available here on YouTube. Electroshock belongs in the category of those devices which society has come to disallow because they're finally recognized as devices of inhumanity and torture. Devices to control, maim, cause fear and terror, blunt the emotions, robotize, make persons and groups more amenable to conformity and authority, identical to the goals of castration, lobotomy, and brainwashing. Electroshock is a crime against humanity. And it's the treatment of next resort after the drugs. And let's call it what it is. And let's wake up and not fall under that spell of biological psychiatry, of biological and genetic defects, and these mechanical means of disabling people. Don't let it happen to your friends. That's shock. It's also true of the drugs. See some of my other videos for gentler ways. Listen to this thing again because I talked fast, I know. Torture is not good. It's not good for a government or a military to do it. Just like electroshock, it doesn't get results. It hurts people. It creates enemies. And it taints the soul and the spirit of those who do it. Y'all take care.